Mikey, you just got over a cold last week. You'll catch another one if you stay out too long.
Be careful! Mom, my eyes look funny.
Oh my goodness, what happened to your eyes and your legs? Luna, Mikey developed puffy eyes and swollen legs after recovering from a cold. What do you think he has?
Edema can come from the heart, liver, his heart and lung are normal.
I think it's the kidneys. Excellent. Let's check a urinalysis and kidney function. By the way, Luna, do you know the most common cause of nephrotic syndrome in children?
Minimal change disease.
Yes. Now, let's see if Mikey's urinalysis supports your diagnosis.
Massive proteinuria? He has nephrotic syndrome.
But if he's losing so much protein function, still normal.
Let's ask our Heroic Nephron.
Welcome! I'm still doing my job. I'm cleaning Mikey's blood and filtering waste normally. But my filter has started leaking protein. Normally, my filter is very selective. I keep important proteins.
So the filtering like a perfect sieve.
Now let's see what changes in minimal change disease.
My podocyte foot processes have flattened, so albumin can escape.
That's why Mikey has massive proteinuria. Wait, if Mikey is losing so much protein, why is his creatinine still normal?
My filter has become leaky to protein, but the rest of the nephron is still working normally. Under a light microscope, I look normal. But under an electron microscope, my foot processes have flattened.
But why did your foot processes flatten?
It all started after Mikey caught a cold. After Mikey's cold, some immune cells became overactive.
They released signals that injured the podocytes.
After some infections, overactive T cells can release cytokines and other permeability factors that damage my podocytes. The exact culprit is still unknown. Prednisolone quiets the immune attack, allowing my podocytes to heal and keep albumin where it belongs.
The prognosis for minimal change disease is excellent. Most children respond dramatically to treatment
With prednisone and recover completely.
That's
wonderful!
How beautiful! But why are antibodies decorating only the podocytes?